Well, welcome everybody. This is the Hopkins Business of Health Initiative webinar series. I'm Dan Polsky, Director of the Hopkins Business of Health Initiative. This initiative brings together scholars from across the university who share a mission to advance health through an affordable and equitable, high-value health system. We focus on the role of business and incentives in advancing this vision. So I'm delighted to welcome you all to this installment of our series, which we call Conversations on the Business of Health. This installment is about health equity in business, which is certainly one of the areas of emphasis of our initiative. So we're very excited about today's webinar. So we're going to dig in today and try to understand best practices and how good business can be good business. And with that, I'll turn the proceedings over to our moderator, Joanne Kennan, who's the journalist in residence and assistant lecturer at Johns Hopkins Bloomberg School of Public Health. Thank you, Joanne, for putting this amazing panel together. I'll turn it over to you.
Hi, everybody. We've been thinking about this topic at HBHI for quite a few months now. So we've been thinking about what does it really mean for business to address equity? So we decided to do a webinar about it. We can't solve this problem without everybody and without money. And we have here not a business, but a foundation affiliated with a business that's really a leader. So let me just start with introducing my colleague, Dr. Lisa Cooper, who is a Bloomberg Distinguished Professor at Johns Hopkins. She's affiliated with both the medical school and the School of Public Health, and she's the director of the Center for Health Equity. And I first heard Lisa speak probably 7 or 8 years ago, 6, 7 years ago, before I had any idea I was going to land at Johns Hopkins. And she actually helped me. She's not the first or last person I ever heard about equity, speaking about equity, but she was really good. And she taught me, she made me think about it in ways that I still carry with me. So I'm delighted to have her here today. And we've got Ebony Thomas, who's the president of the Bank of America Foundation. She's with us virtually from North Carolina. She's been there for the last 8 years. I think I have that right. And I'm going to sort of stay out of the way. I'm going to ask questions, but I'm also going to ask the two of them. They both have a lot more expertise than I do. So I will ask questions, but because we've kept this panel small, it's very hard for people to interact on Zoom the way you can in person with 3 people talking without talking over one another. But let's try. It's like, Lisa, if you want to know more about something as Ebony's doing, just jump in, and vice versa. I just wanted to start with, and Lisa actually also wrote a really good, interesting piece for Harvard Business Review with a few colleagues on some of these issues. So if you want homework afterwards that you can assign yourself, just Google Lisa Cooper and Harvard Business Review and you will find it. But I'm going to read a very, very brief definition from that article. And it's from the CDC. Like, what is health equity? You know, it's a lot more than just giving someone insurance and access to a gym, right? So this is the way, she quotes the CDC, defining health equity as a state in which every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. So it's a broad but thoughtful, because it's not just, right there, it links the health and the social. So I just want to turn it over to Lisa, because start with Lisa, because you're not at the business school, you're at the medical school, you're a physician. And how did you begin to start thinking about, we can't do this without business, and what does it look like to do it with business?
Yeah, so I think, you mentioned something in your introduction, which was, this is a problem that everyone needs to be involved in. And so, a couple of years ago, really right before the onset of the pandemic, I decided that I wanted to write a book, because I wanted to get the message out about the important role that everyone in society has to play in health equity. And I didn't want it to just be limited to people in healthcare and public health who had been working on it for a long time, or even people maybe in sociology or political science. But I really wanted it to get out to broader other groups in society. And so among those groups is big business, really because when I thought about the problem of health disparities, and we talk about all these different opportunities that people have to be healthy or lack of opportunities they have. And one of the major drivers of that is income, employment, economic stability, and those kinds of things, right? And who has the biggest influence over those things? Well, employers make decisions about how much to pay people and can provide them with lots of other opportunities, economic stability that will actually help people stay healthier. They also are anchor institutions in many communities and can have influences on a lot of the social conditions that contribute most to health equity. So I thought partnering with my colleagues Shantanu Nundy and Ellen Kelsey, that we would try to write an article in addition to the book I had written, but specifically focusing on businesses.
So, Ebony, you have Bank of America's has, I'm not exactly sure how the financing between the foundation and the bank works. It doesn't matter. You have 1.25, it doesn't matter for my purposes right now, it matters to you. You have 1.25 billion with a B, and I believe it's a 5-year initiative to really address equity, and you've defined it in a very broad, multifaceted way. You are not going out and buying everybody a house. You are not going out and paying for everybody's health care. You're trying to change the landscape that enables people to have these things. And just like the healthcare system can't buy everybody a house, it's lots of players have to come together. So talk a little bit about, you don't have to give me the laundry list of absolutely everything, but talk about sort of like, as you started building the initiative, how did you think about what is your role? Where do you begin? And then how do you build out?
Well, first of all, this notion of what Dr. Cooper said is something that really resonates with me around the word anchor, right? An anchor institution. And oftentimes people think about anchor institutions as hospitals, colleges and universities, but companies that sit within communities are really anchors. To your point around providing income, healthcare, but not only that, providing advocacy and positions and voices, which is really important. And when to go back and to start at the top of the $1.25 billion commitment, we really have to start at the murder of George Floyd. And I don't always like to use that as the starting point, because inequality and marginalization did not start with George Floyd, nor did it end. But I think for a lot of organizations and a lot of folks across communities, it certainly was a moment of awakening or awareness of the deep disparities. I think the communities had always understood and knew, but there was an awareness and awakening of those who were unaware and who did not know. And we have been doing work in our communities for a number of years. The hallmark of our work is 90 plus markets across the country, where we believe proximity is really where healthcare begins, in people's backyards, in their next door neighbors. And so the way that we deliver resources and thought leadership and resources across these communities is through these places, through these local markets. Nashville is not a place, but certainly Baltimore is, right? Charlotte is. And the way that we do that through this commitment and across other commitments that we have through the bank is through healthcare access, equity, information, education. We do it through small business, resiliency, community development, housing, and job creation. And the thing that we know is that health is the linchpin to all of those things. It is the thing that creates communities and makes them run and function. And a healthy individual has a job or can create jobs. A healthy individual has access to housing. A healthy individual, can have access to small business. And so if we put that at the center of our narrative, of our story of how do we provide, how do we become a catalyst, a leader around healthcare in our community, then we can start to rally other anchor institutions, other businesses, other schools, around this notion that health and dignity go hand in hand, and that allows people to do that work. And so we've allocated resources just to do that. So I'm excited to share more about that today in our conversation. Happy to be here with Dr. Cooper and get in a little bit deeper into what we mean around health equity and health access.
Yes, and I should remind people they can put questions in the Q&A feature here. So I think someone's just did. I'll get to that in a second. And it's a good question. I'll come back to it in a second. When we started talking about social determinants, which again, were always there, we didn't really clarify what that meant. Social drivers, social determinants, the socioeconomic conditions that make people's health worse. We began talking about a greater collaboration between the health system and the sort of community-based organizations, social services and charities and so forth. And that there had to be better connectors, better communication, more two-way, et cetera, et cetera. The healthcare system can't do it itself, nor should it. That's not its goal, but it has to be part of the solution, and identifying where these social factors and health really overlap and where you can do the most by addressing them. Lisa, how is, that's not done. That's still a work in progress, linking health and social services. How are you seeing businesses which have resources and their own ideas and their own networks, and how are you seeing this a three-way partnership or a three-way collaboration? What are you seeing? How unusual is it still that someone's doing what Bank of America's doing?
That's a great question. I mean, I think that there's more awareness among businesses of the importance of doing this, but I don't think this is not the norm for most businesses. I don't think that to be involved more in sort of addressing social determinants. I think where I do see some businesses doing this is that they are starting with their own employees. So they're looking at issues that their own employees may be facing with regard to housing challenges, and providing opportunities, for example, for people to purchase homes close to where they work, helping them to attain loans to buy homes or to buy cars, to enhance their transportation access. They're looking at things like whether or not people can afford food to feed their families. They're looking at whether they need to raise the wages they're paying their employees. And then they're also looking to see whether there are community-based groups within their communities that they can partner with to enhance access to those services for their own employees. So I see a lot of businesses starting to do that, where I don't see as many businesses involved yet, is sort of going beyond their own employee base. So I think it's a good place to start with your employees, because we know that a lot of the employees that work for a business come from the surrounding community. So it's a good place to start. And also it sort of shows your commitment if you're, how they say charity begins at home, that you're actually taking care of your own people, making sure that they have a living wage and that they have access to resources that can address their social needs. So that's where I'm seeing things happening. I liked that Ebony mentioned the access to care piece, because I think that there are some companies that are actually working with community-based providers to see if they can expand access to healthcare by, sort of making sure that their employees are going to those local providers. And also, for example, pharmacies that have urgent care services and things like that, because it's really not only good for their employees, it's also a good business decision. If you think about the fact that, health disparities impact people from racially and ethnically minoritized groups at much higher rates, they impact people with disabilities at much higher rates. And if you're spending more money because your employees are sick, they're missing work, they're in the hospital, your costs are higher, right? So it also makes better business sense, to do some of those things. So I see some increasing awareness of that, but there's still a lot more room for growth and improvement.
One of the questions
Dr. Cooper, you're exactly right. I can jump in here really quickly, because the work started with employees. I mean, to your point, we have 210,000 employees across Bank of America. So what greater test case, right, to look at your employee base of who they are, where they are, and what's important to them. And what they were telling us is that health was important to them, their community was important to them. And so it's like, how do you, now is thinking about how do we marry those two things together? So number one, I love that you mentioned wages. So, you know, Bank of America, we've committed by 2025, every employee $25 an hour across the board, right? Like that's the commitment of ensuring that we're not just talking about, you know, being a leader and how do we help, you know, this notion of how do we help, we are actually doing it, right? And so that it starts there with that livable wage and that livable income. The second part is understanding what's important to our employees. What we found is that health and wellness was singularly the most important thing to them. We learned it through surveys, we talked to them, and so they were really instrumental in helping us develop, okay, so if we're gonna do this for our employees, we wanna actually bring this to our community because they are in our community, their parents, their siblings, their brothers and sisters. And so when, you know, one of the early initiatives that we focused on in the foundation was providing flu shots, particularly, you know, coming out of the pandemic. And we said, well, if we do this, we had a partnership with CVS, is that whatever the flu shot that we provide our employees, we provide our community. So we provided a free voucher through community health clinics, you know, any and everyone to go in, get that voucher, take it to a CVS, you know, minute clinic, and get a flu vaccine. I mean, and you know, I think sometimes we overcomplicate things, but this is where the public and private, you know, relationships can really move, not just incrementally, but be transformative. When we talk about folks and healthcare, we have a partnership, collaboration. You talked about bringing 3 to 4 folks together between American Heart Cancer and diabetes, right? Beyond, you know, violent crimes, this is the #1 killer of marginalized communities, right? These 3 together. And what's unique about this is not just that it's, you know, with American Cancer, Heart, Diabetes, is that these are 3 organizations who have traditionally can sometimes operate in silos. Now the innovation of bringing them together to say, when we talk about outcomes in a community, these are 3 big institutions that can really, excuse me, drive outcomes. And, you know, and thinking about how do we then put resources and power the infrastructure to use their expertise to bring this kind of collaboration together.
You need to run off and get a glass of water. We can have Lisa talk while you do that. Right?
And that's just so inspirational. I mean, I'm so glad to hear about what Bank of America is doing. This is just the kind of example we're looking for, exemplar, so that other people who are just getting started in this work, when they want to know, like, what does it look like, you know, it's exciting. It's really exciting, and we can really sort of leverage everyone's expertise and strengths in addressing these different problems.
Eben, I have two questions when you're ready, if you're able to signal if you're not quite.
I'm ready.
One is how, I mean, you're based in Charlotte, but you're doing stuff like in 20 states, 50 states, you know, 50 states and 5 territories, 9. I mean, how extensive are your initiatives?
Yes. So this body of work is in 11 markets. And when we say 11 markets, we mean cities. So what we did is we used another, you know, amazing public health institution and the University of Michigan to help be our aggregator, to help us with our research, to understand what's the data telling us in these communities that really need it the most. So it took us 2 years to get to a point where we really understood the data, and we were able to match the data to the communities in which we wanted to go in and actually do this work. So we're in 11 communities across the country with this particular body of work. And the idea is, what are we going to learn from these communities? Again, health is proximity. And we need to know that what's going to work in Memphis may be totally different of what's going to, say, work in Albuquerque, because the populations are different. And so we started with these 11 markets. We're in year 2 of these 11 markets of understanding this, you know, how do we provide healthy outcomes, advocacy for communities on what they should be demanding from their constituents and their legislators. But we're in Albuquerque, we're in Atlanta, we're in Charlotte, we're in Chicago, Denver, Detroit, Memphis, Tennessee, Nashville, Philadelphia, San Antonio, St. Louis, and Washington, D.C. So you see it's a cross-reference of cities of size, but we are literally aggregating data with the University of Michigan to understand, right, what some of the barriers. There are different agencies that are leading in this market. So in some markets, American Heart is really strong. So they are the lead agency that's pulling diabetes and cancer together to make sure that we're moving in the same lane. In some markets, American Cancer is better. So it's this notion of now we're bringing together these huge agencies who have the infrastructure, who have the knowledge and the expertise, who have doctors like Dr. Cooper, that can really think about, policy change, relationships with federally qualified healthcare centers, doing screenings, providing medical equipment in these communities. So it's not just us pulling these agencies together. We also are powering it through funding as well. So it's something that we are in the early stages of. We by no means expect that this to be, something that shifts the healthcare industry or system completely on its axis. But what we have learned early on is that there were a lot of individuals in communities that were focused on health that had never talked to each other before. And so when you start to pull people together who are now talking about the community, you start to see movement and you start to see synergies and opportunities for partnership. The other part of it is, if I'm also being honest, is that collaboration is hard. And everyone loves to say, let's collaborate, let's bring things together. It's difficult work. And, you have to be in it for a long haul. But for the organizations who are on the phone, I would say that it's not just the resources, not just the funding. We also do a lot of in-kind. We also do a lot of consulting. We also have a massive amount of Bank of America volunteers who are, pounding the pavements on weekends as well. So it's a full-out effort across these communities to really start to see some of these outcomes that we initially said that we'd love to see in our KPIs.
I want to come back to something that Lisa said in a second, and it's also a question that's come up in the question chat. But I want to ask, before I get to that, I want to ask Ebony one thing. I mean, you have a lot of resources. You're Bank of America. Someone smaller in some of these communities, someone who sees you somewhere or reads about you, or just someone littler, which is almost everybody, calls you and says, I have a lot fewer resources, but I want to start making a difference. What kind of advice would you get for a smaller business or a more local business who probably can't work with the University of Michigan? Maybe they can work with their someplace locally, but they don't have the panoply of tools you have. Well, I mean, you've probably had this question. What do you tell them? If you haven't had this question, you will.
Ask that question ourselves, right? Because, it's also about sustainability too, right? It's like, we can start this, but we also have to have other partners that can come in and help, right, sustain this body of work. But I would say for those who are starting out, is just the desire to start, the desire to want to do it. And then really think about what is manageable, right, within your community. Again, we have an infrastructure where we can do 11 markets because we have that infrastructure. But your organization may have infrastructure that's right there in Baltimore. What then are the opportunities in Baltimore? And really start very small. And I think the small things really make a difference. I often think people think it's these huge, bodies of work that are really transformative, and they can be, and they certainly are. And we expected this one to be, but it's also the smaller grassroots work that matters too. And find out what's important to your employees. Maybe it's maternal health. I mean, women, particularly in a modern continent as North America, and particularly in the U.S., are still dying disproportionately, through infant mortality and maternal mortality. And so I think it's really deciding what is the area in which you want to focus in, and just focus in on that and try not to be so broad, but really focus on that area, and then bring others along the way. Again, collaboration is difficult, but you can start to bring others with you in that journey. But just the decision to start and the decision to focus is the right place.
And Lisa, one of the questions, and you mentioned it and you and I talked about it, but it's also coming up. So let's dig into it a little bit more. The subtitle of this event is, why good business is good for business, right? I mean, in the sense of doing the good thing, the right thing, the ethical thing. Why is it also good for the bottom line? Because ultimately business does care about their own sustainability, their own bottom line. It's way easier to get, whether you're talking about climate or social determinants or whatever, if it's actually good for you, you're more likely to do it. Having a social conscience or an awareness of historically how we got into where we are now and a desire to change it, that's important too. But the bottom line does matter. So what does the research show? What do we know? And what are you still wondering about? What do we need to find out?
So, I'll answer your question, and then I also want to sort of comment on a few of the things that Ebony was talking about. So, there's been research that shows basically companies that invest in resources like primary care services, access to mental health services or telemedicine, who provide that to their employees without them having to, pay a lot out of pocket, and who reduce copays or eliminate copays for medicines that are used for preventive purposes. For example, patients who have had heart attacks or strokes, if the employer covers all of the medications they need, that it reduces the rate of complications, people being admitted by significant amounts, like up to 25%, right? And so if that happens, then the employer is paying less, right, for healthcare, and is able to use that additional sort of revenue to invest in further, in growing their company or growing their financial base. So you've got employees who are healthier. If you're addressing, those issues, you've got a community that is more economically stable, that can now support whatever business, services you're offering, so they can engage in it more. So a lot of the data so far, shows that it's not only the right thing to do, but it actually does improve outcomes for employees and improves, revenue as well for businesses, because it's a lot of investment on primary care and on prevention, which doesn't necessarily cost as much money as waiting for people to get sick and then having to pay for all of the complicated, healthcare services on the other end. So there's a strong sort of business case for doing this as well. But I did want to comment on some of the things that Ebony mentioned, which she really provided clear examples of what, scholars have recommended as the best approaches for employers. So the first thing was basically understanding your population and who it is you're serving, collecting the data on that, on who it is, whether it's race, ethnicity, primary language, income, and the social determinants of health that people are having to, deal with. Selecting a particular problem based on what you've learned from the data and focusing, right? And then actually using metrics to track, what's your success with what you've done, so that whether you need to do more of that, or not. And basically doing that on a regular basis. And then, of course, the commitment, is critically important. First of all, stating the commitment clearly, and then having, clear examples of how you're demonstrating that commitment, and realizing that you're in it for the long haul. So I think that was just brilliant how all of her examples kind of really crystallized the principles and the practices that have been recommended as best practices in research. The other thing that she mentioned, which or alluded to a little bit, was, I think a lot of times people who are in these institutions, we come up with what we think is a good thing to do based on data, for example, or business priorities or whatever, and we start to do it. I thought I heard you say, and I know one of the best practices in this arena is really engaging people who are from affected groups and communities in the process. So having a community advisory board, having if you have employee action groups, making sure that you're hearing from people and that you're actually involving them in shaping the programs and in, just informing you on a regular basis on what the priorities are. So you can collect data through surveys, but you also kind of need to have people at the table helping you to design and, implement some of these programs so that they are acceptable and appropriate. So even things like having people who are navigators of healthcare programs who are from the communities, or doulas. You mentioned maternal health and maternal mortality, which is a huge health disparities problem. Some companies actually are paying for doula care, working with community-based organizations that offer doula services and making sure that they provide that service to their employees. And that, because there's evidence, again, that doing that actually reduces maternal morbidity and mortality.
Absolutely, Dr. Cooper. And the notion of our employees, I get emails daily from our employees who say to me, Ebony, how do I get involved? Healthcare is so important to me, not only from what the bank provides for me, but what we're doing in the community. So the other business case element of this work is the engagement that it brings your employees, this sense of purpose and connectivity to the communities that mean so much from them. People always talk about bringing, if you take a lens from an HR perspective of bringing your whole self, well, you can't leave part of it at the door. It comes through the door, and that means the community that's sick, the community that doesn't have access, the community that's not, in the right space to get the right care. And we're talking about all things around wellness, doula care, mental health services. We have a program also here in Charlotte that is an extension of the equity program that we did, and we're doing a pilot in Charlotte called Meaningful Medicine. We're doing telehealth through Title I schools to figure out the whole family, like this notion of if a student isn't coming to school, we automatically assume, as a former educator, I love this is one of my soapboxes, that the truancy, and like they don't want to be there. No, there's a health concern in that household, whether it's mental, whether it's food, whether it's clothing insecurity, like all of those things is about treating the whole self. And so we have this pilot around meaningful medicine, where we're really with Atrium Health here in Charlotte, really focused on the whole person, the whole family. And we're focused in Title I schools with the hope, and again, what do we learn? Or we can't expand until we understand what we know, what we learn, and how then does it scale. But this notion of the whole individual is so important, and that's the thing that we really try to tackle here. But on the flip side of that, our employees are so engaged that we don't have enough volunteer opportunities to give our employees, because they want to be engaged, involved. They want to be a part of the solution. And so it's truly inspirational, honestly. Yes, I get to do it at the foundation level, but seeing your people, your employees engaged is a pretty good business case too of why companies should be involved in this work.
Without neither of you are in charge of setting premiums or designing the details of a health plan, but one of the questioners pointed out that actually this newer statistics came out like 3 days ago, and it's even worse than this questioner asked. But a family health plan, an employer-sponsored family health plan now, it's the recent survey that came out this week from KFF, $24,000 per year for a family. Okay, the employer pays the bulk of it, and the employee pays some. There's been this, and again, without speaking at a high level, how do we make advances when things cost that much? And a lot of it does end up, I don't know what Bank of America's exact, your co-pays and deductibles. Well, from what I read, you've been addressing that and making it more accessible and more primary care focused. It's still a lot of money. And I guess the question for the two of you, and we could spend 5 hours, well, we could spend a year talking about this. Let's be brief about it. I mean, can we deal with equity without dealing with costs? Do we have to make, on the national policy level, do we have to make that connection that we can't have, you know, a 7% increase this year to $24,000, that it's not going to let us do the other things we've set out to do? Or we're just going to let costs go up and up and up and pretend that there's a break somewhere?
I mean, I can't comment specifically on the, you know, the premium, so to speak, but I can comment on the fact of, I mean, this is why the livable wage is so important, right? This is why when you talk about, you know, equity around income is so critically important. And, you know, we can talk about stats too, you know, in terms of, in particular, the racial wealth gap, but just in terms of, in general, the wealth gap that widens across particularly the U.S. and other countries. And so I think the notion of bringing, you know, one of the things that we also use in our health strategy is job creation. Like this, they actually go together, and we don't try to separate them. So this notion of creation of jobs, and not just jobs within healthcare, but trying to understand what are the jobs in a particular market, what are those opportunities for individuals in a particular city, those high demand jobs, and how do we create pathways to those high demand jobs so individuals can, you know, start to earn a meaningful wage. I won't even say living, but a meaningful wage. And I think they coexist together, and we try to do that work in concert. And you know, try to minimize that. The other thing I will say, you know, we at the bank, for those who are in a who are below a certain income threshold, we have not raised premiums in 3 years. So trying to stabilize those who, again, particularly who are in an income, who's at a certain income within the bank, to keep that flat. And, you know, Brian has made that commitment to do so, again, with the addition of the $25 an hour. And then the last thing I will say, and I'll turn over to Dr. Cooper, because she probably has a lot more worthy commentary that I do on this topic. One of the things we also do here at the bank is we have a group of people called who focus on life events. It's called Life Event Services. And we have a group that they focus solely on our 200,000 people in preparation for life events, new babies, moving a house, your house catches on fire, all the things that can cause individuals to get behind economically, that we want to be there, we want to help you get ahead of it, be a part of it. And so, you know, thinking about that impact that service, that group provides, whether it's monetary, so it is helping them monetarily, but it's also helping them through mental services, you know, wellness, all those things that can affect you when you have a major life event. And, you know, we're trying to think about ways to expand that into the community in support of people, because, you know, disasters or events can certainly set communities back tremendously as well.
Lisa, do you want to add about
the
I mean, neither one of you are health economists, like dealing with the cost drivers of health insurance, but it's a fair question anyway. I mean, I want to really be clear that that's not your expertise or your responsibility, but it is a fair question. $24,000 is a lot of money.
Right. No, I mean, I think it is a lot of money. And I also think that I think Ebony sort of raised some of these points, but it's really, if you understand who your employees are, it's meeting their needs, right? So not everyone needs the same thing. And I think that's sometimes a hard concept for us as Americans, because we often think of equity as equality, where everybody gets the same thing and then it's fair. But not everyone needs the same thing, because not everybody starts out from the same place. So I think things like it's health benefits and healthcare benefits, but it's also things like retirement plans, contributing to those things. It's things like providing professional development opportunities so that people can enhance their skills, so then they can effectively compete for higher paying jobs. You know, and it's not something that's going to be solved overnight, and, you know, which is one of the reasons why, or not by one group. And so that's one of the reasons why we keep making this point of partnering with other folks. So the costs don't have to fall on one person's shoulders, right? And not all of what we need in order to advance health equity is money, or is that costly? I mean, some of it is just people's time. And like Ebony mentioned, there are people who are willing to volunteer their time to provide capacity building for other people. Those are things that mean a lot. They have value, even though they might not translate into a specific dollar investment that a company is making, but that volunteerism and that provision of different kinds of opportunities and those collaborations with different community-based groups, all of those things strengthen the communities that, you know, businesses are in, and actually equip people to be better consumers, stronger consumers, and better employees.
There's a couple of questions that are related, and let me try to sort of merge them. A little bit on how you choose partners, community partners, the grantees or partners, a little bit about how do you track what's working, whether they're working, because you have to know what you know that some things you're going to have to be modified. So just sort of a little bit about your tracking system. And then somebody wants to know, how do I get to be a partner? So I don't know if they're one of the relevant cities. You could, they could probably Google it. But anyway, those are sort of, you know, a little bit about how you're choosing, a little bit how you're tracking, and maybe some thoughts on how tracking has already given you some feedback that you've had to change some things. I don't mean change in a bad way, but just, you know, being realistic. And there are a whole lot of questions come in, so I'm going to try to get through and merge some of them like that. But Ebony.
Yeah. So funding is the same, you know, I go back to Dr. Cooper's original point, is it's research, right? We try to understand what are the opportunities that are out there. Case in point, right now, we're doing a ton of research on, you know, the digital divide. And so, you know, things that we are not well versed in, what we do is do our homework to make sure that when we enter that space, we enter in a very thoughtful and meaningful and intentional way, which we feel like we can make some progress, right? So part of, you know, new organizations is us doing our homework. We love introductions to new organizations that are doing, you know, tremendous amount of work so that we can get to know. Oftentimes other peers of mine across the spectrum, other banks, you know, other private foundations will say, hey, Ebony, are you aware of this organization? You should really get to know them. So they come through a myriad of ways, whether we get to know them ourselves, they reach out to us, others introduce us, but it still starts with the baseline of research and data, of understanding who they are, what they do, the impact that they've made, and is this something that we want to enter in? Does it meet the threshold for our strategy, which again is on health, small business resiliency, jobs, and housing. And so, you know, if it fits within that realm, we certainly take a look. The way we track is like, you know, we have a system in which we are pulling data and metrics. We're not starting from zero. We use a lot of community data in the health initiative, in particular, having you know, Michigan Public Health as our anchor institution that's helping us track and measure is so very important. And we often have a lot of other institutions that help us to ensure that we're doing the right work and that we're measuring it and that we can talk about it in a way that people can understand. And oftentimes I will say this is less about the data and it's more about the storytelling. You know, we can say we did, you know, X amount of this, you know, 50 million this and all that. And it's great, but also people want to know, but what did it do? And who did it help? And what's their story? So we focus a lot on that storytelling too, so that people understand the work that we're doing. And then I think about ways in which people can get engaged and involved. I love that question. We have community.
They also want to know if you're funding research, right, on equity.
Not a lot, but some. Not a lot, but some. But we do, you know, back to Dr. Cooper's point earlier, at each one of our markets, there is a healthcare community forum that we pull together. So they exist across the spectrum. They're institutions, they're public health, they're publicly funded, they're schools. We, you know, on each one of our community boards, it's about, you know, 15 to 20 people that have a interest in public health. And we talk to them on a monthly basis so that we're tracking if we're doing the right thing. The North Star of my team, the North Star of the foundation is to enter all communities with humility and understanding, is to understand what they need and how we can meet that need. We're not trying to have people run in circles to get funding, but we want you to do the work and do the mission. And if we can be a part of that in a meaningful way, that's the way in which we enter those relationships.
This is a good question because we've talked about the health system, business, and community groups, but government is also obviously has a role. And what are you seeing for, Lisa might want to start answering this. CMS and CMMI have done some things about equity, and they're the first social determinants screening rules beginning to go in and so forth. But like, does this have to be made part of payment more explicitly to reward, to make equity something that becomes part of the, whether it's conditions of sort of participation, or there are lots and lots and lots and lots of payment levers in healthcare. We do not lack metrics, and we do not lack payment models. How much is that happening, and how important will it be to make so that this really, so it gets baked in, to use a cliche that's useful in this context? Lisa, you want to think about that?
Yeah, I mean, I'll talk about it a little bit. I think that it's not happening as much as it should be, but there's some conversations going on around it now. So CMS actually does have a framework around advancing health equity. And I think that is helpful. I think making, putting into like requests for funding some specific expectations around, companies or entities like partnering with community-based organizations and demonstrating that there's community engagement in the work and that there's community capacity building in the work. I think that's important. I think including equity metrics, so having the data that is collected be stratified by these different demographic factors is important. And also, I think it's important to sort of capture not only the medical related outcomes, but also some of the social metrics. So I see it starting to happen. It's not across the board at this point in time. There's a lot of advocacy that is going on at that level by a number of people, researchers, other health equity experts in policy that are really, really pushing for this. But, as you can imagine, with everything in healthcare, there's pushback against sort of requiring that people collect data, because while it's important, we also know that the organizations that have the least ability and resources to do this are the ones probably, serving people with the greatest need. So there also needs to be put into place not only the expectations around it, but the government agencies themselves ought to be providing some support and capacity building for organizations around how to do it well, and giving more guidance around it. Otherwise, I think it could be something that actually ends up hurting people who actually are doing some of the hardest work.
Another question in terms of how, when you go into people who are new to this, Ebony, and you start talking about business and equity and health equity, do people still think you're talking about employee wellness programs, or some people will, but I mean, are we mostly past that? Has in the business world that you're working in the partnerships you have, are people understanding this is a lot broader than what we used to think of as workplace wellness, that these are deep social?
Yeah, absolutely. I mean, I get calls, emails, requests all the time to say, hey, we see Bank of America doing this work. We love to understand, how'd you do it? Like, what does it look like? We're excited to share that. Like, we need more, of these kind of private partnerships, right? To come into the healthcare space. I mean, that's where you're going to actually see the change, because you talk about the resources, right? Government plays a part, business plays a part, community plays a part. They all three play a part, and so we think that's the way that we think about it. One of the outcomes here is, making sure that people understand how to advocate and how to navigate, local and state legislation around healthcare, and arming our local communities with that knowledge, right? And so we recognize that they are a critical part of the work, but absolutely they understand that this is more of a community, around social and economic mobility play than it really is just about employees. However, what I always start with, what I did here, was that it started with our employee base. It started with understanding who they were and what they needed. Again, entering with understanding humility and asking the right questions, and then we can go out to the community to start to do the work.
Let me ask you both a question about sustainability, right? The Ebony started talking about George Floyd, and it was also when we were in the pandemic, and even those of us who knew there were terrible health disparities in this country were still, it really hit us on the head how big they were. You couldn't ignore it. The difference in death rate and illness rate and hospitalization rate were horrific, and there was a wake up call. And then we also had the violence and the judicial police movement. You're not going to be able to sustain the exact same level of energy every single day. There's going to be ups and downs in any endeavor, but is the intensity, sometimes it seems to me, and it's not, it's a perception, and I'd be really happy if you tell me I'm wrong, that while it hasn't stopped, there doesn't seem to be quite as much oomph as there was. And I don't want to put you on the spot because you're doing great work, and so I want you to answer this in a way that you're comfortable answering it. Do we still have that sort of hyper, are we giving it the attention it needs and deserves over the long haul? Because it doesn't sort of feel to me right now, it feels less. And maybe it's just where I am or what who I've talked to in the last few weeks. Maybe I'm wrong. Or maybe it's just natural ebb and flow and you feel confident. But it just doesn't feel quite as, oomph is the right, I think oomph is the not technical term, but an accurate one.
Yeah. I think the thought is the urgency gone?
Gone, but diminished.
I will answer from my vantage point of working at the bank, because the urgency was never about the moment. The urgency was always about the long-term outcome. And so I think if people focused on the moment, they may have lost sight of what the end game is. And so I will say that at the bank, the work that we do never lost momentum, hasn't lost momentum. The commitment's still there, the dollars are still there, the resources, the energy. And when you say the energy, I was like, I know this energy. I started a call yesterday and I got on with the Christie Foundation. He was like, where's all this energy coming from? I'm like, that's just what we do around supporting communities. But I do think that one can say, there's certainly surveys, there's certainly work out there that suggests that some of the momentum has waned. But I always question, well, who were they and what were they doing and what was their motivation to be a part of the work in the first place? And so for us, it was never about just, again, the moment. And what we did was just heighten it, elevate it, to your point, the health disparities couldn't be ignored. So they were always they were front and center, but we
have done a good job of ignoring them for a long time. They can be
for a long time, for sure. But I think, I think the places where we've seen it, it may not be as loud, but it's still present.
Lisa, what's your perception? Because I'm going to, and then end it with a really optimistic question. So you can be a little gloomy because we'll have a high note afterwards.
Right. Well, my perception is that, that this is something that happens frequently with, issues that get a lot of attention in the news and in the media, is that people get really focused on it for the time being, and then they move on to, something else. But my hope is that people really got the take-home message. And if we can continue to drive these messages home, like one of them is that, first of all, health is not only about going to the doctor and having medical care, or even about individual decisions we make. that I hope people got the lesson is during the COVID pandemic and all the things that happened after that, is that health is really about a lot more than that. It's about opportunities that we have in society that we don't have, and the sort of inequity in those opportunities. And that it's about these things that are outside of individuals' ability to decide and and do. And so that it's something that's bigger than any one person or group of people, that is about things that affect all of us. I hope people got that, and we need to continue to drive that home. The other thing we need to continue to make the connection for people on is that, that inequities affect a lot of other things. They don't only affect health. They affect things like safety. They affect things like civil unrest. They affect things like our economic viability and competitiveness on a global level. So if people can see the connections among all these things, then maybe it'll help them understand and care more about it, that it's not only about this group over there or that group over there, but we actually all do worse when we have inequities in the system. Not only the people who are doing most poorly, but our entire country actually is less healthy than most other countries that have less money than we do. So I think we need to continue to keep that up front. And I think that there are people that are in the trenches and who are committed to this for the long term. And those of us that are in that realm, it's going to be up to us to continue to make sure that people who just sort of caught on to it for the moment don't forget.
Well, I'm going to conclude just by reading a question. And if you want to answer it, you can answer it, but maybe it's just the totally right note to end on, because it's a great comment. And it's from somebody who is calling him or her or themselves anonymous attendee. What advice do you have for someone that works at a health research firm and wants to get more involved in health equity research, but their company does not have projects based on equity? Should I speak up or change jobs?
Well, two things I will say. Speak up, but I also think that you can get engaged in health equity without the help of your organization. I mean, I can give you a list of nonprofit organizations who would welcome your expertise and your knowledge, right? We also have to think about, many of these nonprofits, community health centers, right? They are limited capacity. And so if you have the capacity to provide them with education, professional development, training, just your basic, expertise, they would welcome that. I think there are ways in which you can demonstrate to your organization the meaning of this work and how meaningful it is to you, and try to bring it into the fold. But I wouldn't limit your involvement to that of your company if it's something that you're truly passionate about.
Lisa, just ditto.
Well, I'm definitely the same thing. I always think it's important to speak out about what's important to you, and to try to make people see what is in it for them. So if you think about it that way, not only talking about it as something that you're interested in, or that is something that's good for society or whatever, but really helping your organization to see why it might be a good business decision for them to do it. I think that would be important. But, at the end of the day, if your values are not aligned with the organization that you work with, and it's continuing to be a source of discomfort for you, I would say that there are lots of other places that are doing this. So, definitely try, but don't put yourself in a box if it doesn't work out.
This has been a fantastic conversation. We debate about how many people to have, and when we decided to just have the two of you, it's always a good idea at the end to know that it was the right decision. You were both terrific. It was a really useful and provocative conversation. Thank you. And a lot of questions, I got to most of them. Thank you for those of you who I didn't get to. I did a pretty good job of merging them and raising concerns. So this is a conversation that I hope people have in their own workplaces. We certainly have it at Hopkins all the time. And I think Ebony and Bank of America have really given everybody on this call a lot to think about. So thank you.
Thank you.
Thank you.